Well, first of all, the incidence of this aortic disease is relatively low. So only, let's say, 5 in 100,000 inhabitants will suffer from such a problem. But if they suffer from this disease, it is a very extensive problem which requires a very complex procedure. The operation is done by us as surgeons, but obviously we need a phase before the operation. All the information we receive from the patient are judged by the surgeon, but also the risks are analyzed by the anesthesiologist and the cardiologist. And we discuss this in a multidisciplinary team, and then in the team discussion we decide whether we go for treatment A, treatment B, and really a tailor-made approach for that specific patient. Then the patient is operated, and this complex operation, whether it's open or endovascular, needs a continuous dialogue between the surgeon, the neurophysiologist, the anesthesiologist, and this team, in this dialogue, determines the good outcome of the patient. But it doesn't stop after the operation. This continues, of course, in the intensive care when the patient is moved in that ward after the operation, where the team of anesthesia, intensive care specialists, and the surgeons continue to take care of the patient.
During this surgical procedures, several complications can occur, but the most devastating complication is that the patient is not able to move his or her legs afterwards. We perform a so-called MEP monitoring, but it's very simple. We just apply an electrical stimulus to the brain. During the surgical procedure, the spinal cord, which is in between the brain and the legs, and of course also the hands, might get too little blood. And if that is the case, the legs won't react anymore on this electrical stimulus, and we can measure that throughout the whole procedure. And this is important information for the surgeon. So we have done this measurement meanwhile in more than 800 patients, and we are very confident in it. It's very robust and accurate. It just works in every patient. So the surgeon is informed every time he does a TAA repair whether these MEPs, these potentials, are good or not. So every time when the potentials are good, the patient is able to walk afterwards. So meanwhile, we have a team of 3 people, 3 experts who can do it. We have a 24/7. I am not in the OR anymore, but I have an internet connection. We have a technician, of course, who is all the time in the OR, and we communicate constantly. So we are always able to do this measurement.
Because of the multidisciplinary team, because of our experience, and because of the large number of patients coming to us, we can consider ourselves as a center of excellence in this specific field. And being such a center, we are at the front line of all new innovations, new developments, in close cooperation with our researchers, medical industry, guaranteeing that the patient receives the most optimal treatment you can get. I can assure you that, on behalf of the whole team, we will offer you the best treatment you can get for this complex disease. And therefore, we will take care of you here in Maastricht.